Good evening, everyone, and welcome to another hour of Healthy Conclusions, where we try to give our listeners important information on nutrition, exercise, and holistic alternative and integrative medicines. My name is Bob Neugebauer, and I will be your host for this evening's show. Tonight's show is being brought to you by Altrua Health Share, which has been serving its members and their families with their health care needs since 1997. Please take a moment to visit their website at altruahealthshare.org or call 888-244-3839 to see just what Altrua Health Share can offer for your family's health care needs. It could mean substantial savings. Our guest for today is Dr. James Hollingsworth. Dr. Hollingsworth is a graduate of Palmer College of Chiropractic and has been practicing chiropractic since 1984. He is also a practicing hypnotherapist, using hypnotherapy for medical purposes like pain control and for performance-based activities like sports and music. Good evening, Dr. Hollingsworth. I understand that physicians run in your family. Could you tell us a little bit about that?
Well, my father was a great physician, surgeon. My uncle was a great physician, surgeon. And my grandfather was a great physician, surgeon.
So what made you take up chiropractic?
Well, a lot of things happen in life, and that one time I was on a vacation with a friend of mine, and he was a chiropractic physician, and we went for a walk one day, and he just mentioned to me, why don't you become a chiropractic physician? And I was looking for something else in life, and I started down that path, and it fit in with what I was already doing as far as helping individuals, and so I've been practicing now for about 33 years.
That's quite a long time. You must have quite a base of patients.
Well, there's quite a few of them. If a person's a good servant, then people return.
That is true. Is there anything you'd like to tell us about your past in terms of interesting things, or what you've been practicing in the past history, what schools you went to for our audience?
Well, I graduated from Boise State with a BS degree in health science, but way before that, I started out as a good son. My father was what medicine was always meant to be. He was a great servant. He put the patient in the center of the world, and I used to go down to the office and watch him work, and he would crack the door so I could look and see him. I couldn't see the patient, but I was able to watch him. He had a book, and this book was an interesting book. When I was 11 years old, I pulled it off the shelf, and it was by an Australian physician named Ainsley Mears. I read it, got it, and started doing it, and it was on medical hypnosis. But it wasn't about dealing with just psychoses and neuroses. It was also how to modulate human systems. And that's sort of my start, all the way back at the age of 11.
Human being is kind of an odd creature, especially when it comes to the mind. I know I found that out in my past history. You mentioned you got interested in hypnosis because of a certain Dr. Milton Erickson. Could you tell us a little bit about why he piqued your interest in hypnosis?
When I was 18, I ran into the works of Milton Erickson. And Dr. Erickson sort of fit a model of what I believed healthcare to really be. He, rather than doing therapy on a person or to a person, he gave people tools of change, and he evoked out of them their own responses. He evoked out of them their own answers. And that made perfect sense to me. So, and he also, when he was a boy, he contracted polio. He was paralyzed from the neck down, and as it says in multiple writings about him, he could only move his eyes. And he could speak, but that was it. And then one day his mother had his little sister. And he said something like, "Mama, put me down by her." And when she would twitch a finger, he would spend days and weeks until he could twitch that finger. And he taught himself how to move, turn over, and walk again. And then he went to the head of the Mississippi and took a few dollars and pedaled down to the Gulf to build up his strength for medical school.
This is with polio he did this?
He taught himself how to recover from polio.
Wow.
He broke the bounds of what it made sense that people could do. He didn't live inside this box. And so when I read his works, it just made absolute sense. He had the same nature as my dad. And so I just knew what I wanted to do.
So it was really a case of mind over matter. So it shows us that you can actually do some things that your body says you can't, but your mind says you can.
And that's what attracted me to him.
Well, can you explain to the audience what hypnosis is, or explain it in your terms so that they understand what it is?
Well, that is an interesting question, because a person could Google that and find a myriad of answers.
I know I did.
And the answer really is it's a natural state. It's something that we do all the time. Milton used to say, everybody goes into trance if we just let them. And that trance that we go into is an everyday trance, sort of like we're driving down a road and realize that we just drove 20 minutes or 20 miles and have no recollection. Or getting so absorbed in a book that time passes and it seems like 5 or 10 minutes and it's really a couple of hours. This state is the trance of hypnosis. And people tend to go in and out of this state naturally. You know, God made us with this ability and talent. Hypnosis is a utilization of the means by which a person enters this state and can stay in this state, and a lot of times access their wealth of talents and skills and abilities and resources that help them grow and become a better and truer version of themselves.
So you're saying that when you're under hypnosis, you can do things that you might not normally be able to do while you're conscious? And consciously knowing you're doing them?
Yes, you can make somatic changes, body changes. There are those stories that everybody hears about where a person will lay on 2 chairs and they'll be able to suspend a tremendous amount of weight because they'll think of themselves as rigid. And those are more of the stage hypnosis type phenomena.
What are the different types of hypnosis phenomena that you wanted to talk about today?
Well, you can have self-hypnosis, where a person just enters hypnosis while they're doing normal everyday activities or doing it intentionally. You can have the conversational hypnosis, where a person just gets bored and their mind wanders, and then they pick up later that there's something going on. There's that stage hypnosis, which I'm really not very interested in. It's the same phenomena, but there's sort of a bridge there that if it gets burned, we can't recover. And
when you talk about stage, you're talking about somebody being on a stage?
Well, somebody like going to the fair.
Okay, fine.
Many times I've fixed those people after they've gone. But my interest is in clinical hypnosis or hypnotherapy, how to utilize this state to help people become a truer and better version of themselves and deal with the things they want to deal with.
So how long have you been practicing hypnotherapy, and just how difficult is it for one to get trained in hypnotherapy?
Well, my training is one of experience. I have taken quite a few classes over the years. In Idaho, there's no licensure, there's no certification, and so I did it within my chiropractic physician license, because in chiropractic we believe that there's 3 basic causes of disease. Poisons, living in LA and breathing, trauma, getting kicked by a cow or hit by a car, and the last was autosuggestion or stress. That's one of the reasons why I became a chiropractor, is to deal with the somatic problems in that way, as well as I'm doing with hypnosis.
So you're talking about stress as one of the primary problems that you deal with?
I deal a lot with stress.
You know, I understand that stress is probably one of the foremost creators of autoimmune diseases and just chronic diseases because we just can't get out of that stressful atmosphere that we seem to be in constantly.
Mm-hmm.
Can you actually get somebody out of that by using hypnosis?
There's quite a few different ways to do that. Sometimes I'll give them a little something to do. They can do this with their eyes open or closed, and if you're listening to this driving, you obviously don't want to close your eyes. But it's almost as if you could have a person imagine themselves having an anxiety state where there's a lot of disturbing situations going on, creating this fulminating problem inside. And I have them tell them a little metaphor. That's one thing that Milton did. Milton told stories that evoked out of people their own response. And that's what we call indirect hypnosis. Rather than telling a person the way they're going to be, I don't tend to work that way. I use indirect hypnosis. I let the answers come out of the person. And so I'll tell them a story, almost like that there's butterflies of chaos going off inside. It's really disturbing, really upsetting. And most people know that sensation. And then all I do is say, now why don't you just let them land and let their wings interlock, forming a carpet of power and passion and purpose, to feel that sense of ease and silence and quiet.
So this is where the suggestion comes in, or the power of suggestion. Is that correct, or no?
It's a direction. Rather than a direct suggestion of this is the way you'll be, to let them find their own way with their own answers. And that is, I think, the best therapy in the whole world.
We're going to have to take a quick break here. We'll be back in a few minutes, folks. You're listening to Health Conclusions, brought to you by Altrua Health Share, and that's altruahealthshare.org with your host, Bob Neugebauer, on 580 KIDO. Welcome back to Health Conclusions on 580 KIDO. We're speaking with Dr. James Hollingsworth, and this part of the program is sponsored by altruahealthshare.org. So, Doctor, we talked about how you got trained in hypnotherapy. I know you personally because you used hypnosis for pain management for my wife when she was dealing with cancer. But what other ways do you use hypnotherapy, and what types of patients would you use it with besides the pain? And how does that pain hypnotherapy work? How does it affect the patient?
Well, again, going back to Milton Erickson, one thing he always had was a lot of pain. And so in all of his writings, he discusses, and there's a lot of writing about this pain that he had and how he dealt with it. And so all of the countless hours, I've had about 11,000 recorded sessions over these 40-some years, and everything of great value has been taught to me by patients that sat in the chairs. That's where my great learning came from. I've taken regular classes, but the bottom line is the greatest teachers have been my own patients. And they've brought with them their own particular problems, pain, asthma, gastroparesis, or the inability to empty the stomach correctly, a lot of different things. And that's really where all of this directs in my life. And that wasn't just about doing hypnotherapy, but it was about doing medical hypnotherapy. There's a lot of different people that can do hypnosis, psychologists, psychiatrists, social workers, but they come from a different point of view. They don't come from the point of view of how to modulate anatomic systems, because they don't know a lot about the body. Some are highly trained.
Could you explain what you mean by that for our audience on modulating anatomic systems?
Well, for example, let's say a person comes in and they're having cancer treatment. So I was the keynote speaker at the breast cancer conference put on by St. Luke's back in, I think it was 1999. And I spoke on the works of Ernie Rossi. Dr. Rossi was a Jungian psychotherapist and quite a student of Milton Erickson. And I presented his work. And his work was very clear that when we have a thought, that thought, as you know, travels along a nerve. And that nerve then comes up to a junction to another nerve or another synapse. And then that nerve will release a neurotransmitter, and that will allow that electrical impulse to jump across from one nerve to another. Well, we know thoughts. We know electrical impulses. But what Dr. Rossi discovered was the beginning of what we call epigenetics. Those things above the expression of the genes, what causes genes to express. And so what he found is that, and he was a great researcher, not just a practitioner. And so what he discovered was that this thought actually becomes changed into a physical molecular message. And that message is formed within what's called the hypothalamic hypophyseal portal system. Very complex area of the lower portion of the brain. And then that little molecule will fall into that hypophyseal portal system. So it falls into the blood like a leaf falls into the canal. And then it will go to the body, carried by the blood, and it will interact with the appropriate target cells. And that gene will then wake up using endoplasmic reticulum and all the mechanisms of transcription. That gene will wake up, express the protein that makes us better, and then goes back to sleep.
So you're talking about being able to actually energize your body through hypnotherapy so that it releases what is necessary to get the different parts of the body to react in a certain way to help with diseases,
yes,
to help cure them, or to help make yourself better, your body better?
It's not about me doing anything.
I understand.
But what I do is give patients tools in which they can modulate their own systems. So this idea and this whole area is called psychoneuroimmunology. And that's a big fancy word. And it's actually, the word is very old now. And it's not the best word in the whole world, but it's the best word we have to describe that there is a mind, psycho, and there is a nervous system, the brain, spinal cord, and nerves. And then there is the system of organs and tissues that work together. And that's where that immunology comes from. And when a person comes into me, let's say with cancer, they come to me and they ask for different things. One is pain control, because it is not a comfortable thing getting cancer treatment, whether chemotherapy or radiation. They come to me, maybe, is there something they can do for themselves? Because most cancer patients have things done to them, but they don't have anything they can do. And so, as we know in medicine, is that there is an immune system, and we know there are T cells and B cells. But there are some cells that are very important in dealing with infective processes and parasites and cancers, and those are what are called the natural killer cells. And the natural killer cells actually are in between T cells and B cells. And so I'd have somebody sit down and I'd tell them a story. I remember there was a young man, wonderful fellow, and he had a stem cell transplant, and he was not doing very well. He was in mortis, which is Latin for he was dying. And his sister was a psychologist, and she came to me and said, "Would you see my brother?" And I said I'd be honored. And I went over to the hospital, and I told him a story. And the story, sort of a dumb story, but I told him a story because he loved tractors. And I had him imagine, but not just tractors, he liked PTOs, which are the power takeoffs, where you'd hook up implements and threshers and balers. And then I just had him imagine putting those PTOs in the marrow of the bones.
How did that affect him?
It increased the levels of white blood cells.
So you could actually do that by thinking it?
That's what Ernie Rossi, he opened this whole new world of how to use hypnosis, this natural state that we have, to change body function. Another good example was I also work in a clinic in Pocatello one day a week. And there was this young lady that came from Wyoming, wonderful young lady. And I have permission to speak about this, and as I did on the other. And she was a rodeo girl, and she rode for the University of Wyoming. And she ended up, had terrible asthma. And guess what she was allergic to? Horses.
Oh, my.
And so every time she got around a horse, she would have to use this inhaler. And she was using it multiple times a day. Way too much.
It's not good for you.
So she came in, and I said to her, how hard do you hold on to reins? And she said, well, it all depends. And she said, usually quite lightly. And I said, and you can grip them harder, can't you? And she said, yes. And I said, you can relax your grip, couldn't you? And you can tighten a grip, can't you? And she said, yes. And I said, well, would you mind closing your eyes? And we did some work, and I had her imagine these fists in the bronchi relaxing. And I had her imagine relaxing. Because, see, secondary and tertiary bronchi have muscles. And when she relaxed those, the airways opened.
So you were actually able to help her with her asthma.
It was the last day she used an inhaler.
So, oh my goodness! Wow. So
It wasn't me.
You're telling me the mind actually does have a major effect on your body and the diseases you have.
Her mind had a great ability in that particular situation.
Okay, Doc, we're going to have to take another quick break here. We'll be back in a few minutes. You're listening to Health Conclusions, brought to you by AltruaHealthShare.org with your host, Bob Neugebauer, on 580 KIDO. Welcome back to Health Conclusions on 580 KIDO. We're speaking with Dr. James Hollingsworth, sponsored by AltruaHealthShare.org. So, Doctor, we're talking about how the mind can actually heal your body, which I think is absolutely amazing, but we've known this for some time. So, you know, if we could actually do that effectively on everything, we wouldn't really need a lot of doctors, would we? We just need a lot of hypnotherapists.
Well, I think Edison said something about we are our own best doctor. And really, this is about whether it's a scalpel for a surgeon, whether it's a syringe for a family practitioner. This is a tool that a person can learn to help themselves. But it's a tool that they have to learn how to control, how to use, how to perfect, and the more they practice, the better they get.
So how many sessions would somebody have to go through to learn how to, say, manage pain? I know it took my wife one or two. She was pretty adept to it. But how long would it take a normal person to go through something like maybe your asthma or somebody who has, I don't know, could you cure psoriasis? There's another problem.
Well, that is a good question. Milton Erickson was a brief therapist in that he didn't schedule people for multiple visits. Some he might have, but for the most part, he met them at their own level and gave them what they needed. And for example, when somebody wants to come in to see me, I send them questions. And these questions are not just about them and their disease process, because I think Sir William Osler said something like, it's as important to know the patient that has the disease than it is to know the disease that has the patient. And so I'll have them write about themselves. and ask questions about why they're coming in and the history and what they've done that has and hasn't worked, and has or hasn't worked. And then what happens is, rather than spending a lot of time and money in pulling all of this out of them at a later date, they send it to me in advance. Then when they come in, I have now what I need, sometimes to help them immediately or to bring out of them more of the answer that I need. And different conditions take a little longer period of time and a little more diligence. And different people are more adept at hypnosis than others. I think, like Milton says, everybody goes into trance if you let them. Just get out of the way. And if I just am observant and pay attention to the person and how they're doing and how they respond, then it might take one visit, it might take 5, it might take 10. I don't know. But I'll know as we go along. Now, the great thing about this is that rather than having to go in and have a visit each time, I record the session, I send it home with the patient, I give them directions that they need to listen to this every day. Well, what does that do? They now have a session every time they are listening to this. But the second thing is they're practicing. They're getting better. Just like playing a piano. Da-da-da-da-da-da-da-da. Well, the more I practice, the better I get. And then what happens is there is this sense of, I can do this. So.
Wow, that's terrific. Just kind of curious, do physicians and psychologists refer patients to you?
Yes.
And for what purpose?
Physicians tend to send me patients with actual medical conditions that they want work on. For example, people that have fractures that may be non-healing. I've had some orthopedic surgeons send me patients because they know that when a person smokes, the nicotine, which is a vasodilator, well, if they're having surgery, everybody knows that the wound healing is so much worse if they're a smoker. And if they can quit smoking a couple of weeks prior to the surgery, their healing rate is faster, the knitting of the tissue is much better, and so a lot of the orthopedic surgeons will send me people for that. Typically, a person, 9 out of 10 people that come to my office are done smoking in one visit.
Wow. I know I quit smoking in one day, but I'm kind of a different person. I'm able to control myself that way. But I know people who have been trying to stop smoking for years and can't do it. But that's amazing.
Now, the psychologists, they are very highly trained, and the social workers are very highly trained in their particular field of expertise. Like all physicians, I'm always looking forward to somebody that I can refer to and trust. And so what's happened is the social workers and psychologists that refer to me because they've had a client come to me, and that client will then go to them, and they'll say, this fellow did a good job. He treated me well. And they will sort of pick that client's brain as to what I was like. And they may send me somebody, and I earn their trust that I'm going to do the right things by their clients. And I always work in conjunction with them. I don't say, well, you need to see me and not see them. I said, no, you see them, you work with them. And everything I do is going to work hand in hand with what they're already doing. And so it's been a very wonderful life working with these multiple providers, not just in the psychologic field, but also in the medical field.
So you're working with both allopathic conventional doctors and naturopaths?
Sure.
Plus people on the psychology end of this whole thing.
Sure.
So you've got quite a varied group.
I'm a very fortunate human being to have these people refer to me.
What other diseases or physical problems would you use this PNI for?
Psychoneuroimmunology, again, is a word that represents the whole field. But you could have psychoneuromyology, psychoneurogastroenterology, psychoneuroosteology.
These are all separate.
In other words, they're
Parts.
all separate systems of the body.
Right.
For example, I mentioned before, like bone fractures, non-union fractures. Person can tell them a little story. The story might be imagining I remember a little girl came to me that was about 6, and she did a cartwheel off of her couch and broke the radius and ulna in the forearm. And her mother called me on the way to the hospital and said, my daughter is in terrible pain, and can we stop by? And so I went out to the car, and I got the little girl's attention, and I talked to her in the way she needed to be talked to, and she developed a nice trance. And I numbed the arm from above the elbow down. And she went to the hospital and went to the ER, and the nurse looked at her and said, "You must be going into shock because you're not feeling any pain." And the nurse said, or the mom said, "Well, no, we stopped by Dr. Hollingsworth's office, and he did some hypnosis and numbed the arm." And she looked at the mom and said, "But you cannot hypnotize a child younger than 13. And the mom looked at her and said, "I am so glad my daughter didn't know it." And what ended up happening, I had her imagine little brick masons, little men at the ends of her fingers that would sort of flow up in the arms, carrying a little bucket of beautiful, glistening, gleaming white calcium, and then taking a trowel, and I even showed her a trowel later, and how to work that calcium into the bone. And the orthopedic surgeon on the case called me one day and said, "Who are you and what are you doing?" And I said, "Well, sir, you'd have to give me a little more information than that." And he then mentioned the patient's name, and I said, "This is all I did." And he said, "This is healing at 1/3 the normal rate, or 3 times the normal rate." I
Wow.
just couldn't believe this. So anyway,
Mind over matter.
the mind can modulate the matter of this great system that God made.
Well, I'll tell you, this is getting more interesting as we go along. You know, I've read many, many articles and books about people who have actually overcome their diseases by just mentally thinking that they're going to get rid of them. We're going to have to take another quick break here. We'll be back in a few minutes. You're listening to Health Conclusions, brought to you by AltruaHealthShare.org, with your host, Bob Neugebauer, on 580 KIDO. Welcome back to Health Conclusions on 580 KIDO. We're speaking with Dr. James Hollingsworth about hypnotism. It's sponsored by AltruaHealthShare.org. So, Doc, we're talking about the mind being able to control the body. So if the mind can control the body, tell me, what other situations would you use hypnosis for? Can you use it for sports, or can you use it for maybe music, or teach people how to do things differently?
That would be the third side of my practice. The first one is chiropractic care, and the second one is medical hypnosis primarily, and then the third one is how to actually improve performance. Back in 1986, there was a physician in Utah that sent me a golfer. He was a professional golfer, and he wasn't playing up to his abilities and talents. And this young man came to my office, and we did some work together, and he got better. And he sent me another golfer from Arizona, and that golfer sent me a swimmer, and the swimmer sent me a drag racer. And so all of these people have come to me in all these different disciplines, because I've never been trapped within one discipline, whether it's archery or sculling, which is those little skinny boats they use in the Olympics. And so I teach people two things: how to be fully present in that they're doing. And the second part is how to actually improve. Now, there is a portion of your brain called the anterior cingulate cortex, and it verifies reality. That's the part of you that knows you're awake right now. You don't know how you know. You just know you're awake. Well, that little piece of tissue in the brain, the anterior cingulate cortex, ACC, it does something very important in a very specific time, and that is when an individual internalizes away from external reality. For example, if I took your hand and put it on the chair and your eyes were closed, would you feel the chair? No. You have force transducers that send signals through the brachial nerve into the spinal cord at the substantia gelatinosa of Rolando Rexid lamina 2 and 3.
You're getting way too technical for
I
me.
know.
We're talking about a chair.
A nerve comes into the cord, goes up to the thalamus, goes to a very specific portion of the brain called Brodmann's area 532. The brain tells you it's a chair. We don't feel the chair directly. We feel it through sensors. Hypnosis is when we disconnect from external sources and get internal. When we're so much inside that the outside disappears, the world changes. And so with these athletes, I have them focus on their best, no longer on their errors and mistakes. I just have them fix that. But what they focus on is those things they do well. They shift inside, they disconnect from external reality, and they dwell. And when they dwell during a trance state, the brain thinks it's real. And then we become what we think about most often. And so not only athletes, I've had a viola player in Europe that was traveling to get her to pass and get into one of these orchestras. And so we'd do our work over the phone. I had a young man, Wesley Moody. He was quite a wonderful tennis player. And he and his partner, they were getting ready to play at Wimbledon, and called me the night before. We did our work. He liked it when I would put him to bed at night, wherever he was in the world. And he was going to play the next day. He ended up winning Wimbledon, that little tennis tournament over there. And so, you know, all human beings play all these sports. And it doesn't matter what the sport is, it's played by a human being. And even though they think their sport is different, it's really all the same, because a human being plays it. And so I just bring out of people their own abilities and talents. I change their focus from what's wrong to what's right. Fixing what's wrong isn't going to make life better. It's using what's right in a person's life to help them get better. So that's the other part of this. Or I'll get attorneys, I'll get that haven't passed the bar, or CPAs that want to pass their tests, or nurses that want to pass their board certification. And they will have not passed a couple of times, and they'll come to me, and I'll make them a track to help them study better, and then to get their mind ready to go in to take the exam. Rather than proving themselves, just be themselves. Let the butterflies land, and take the tests in excitement and pleasure rather than the three stooges that hold us back: fear, worry, and doubt.
So you're instilling positive thoughts in these people, and those positive thoughts are improving their performance in a lot of different ways.
Yes, I'm bringing out of them that is the great and good. They're already good.
So tell me, are you responsible for Tom Brady winning 5 Super Bowls?
Boy, wouldn't that be fun to be able to say. But you know what's even better in my life is when a young girl, young boy, that might not have a lot of role models is able to find and become. That's just as important to me as anything else.
So let me ask you, these sports figures, do they take these tapes with them when they go on the road and they use those? Is that their part of their positive and reinforcement?
Yes. Most of them put them on their phones, so they're with them all the time, and then they play them before practice or competition. And it's this whole idea of falling in love again. I got to fall in love, because normally a little boy, little girl, they start playing a sport and they're wiggling in their seat. They can hardly wait to get out to do it. But what happens? The more they learn, the more unhappy they become because they try to be perfect. And then they fall out of love.
So we're our own worst enemy.
That sure can be the case sometimes.
That's amazing. Just a few more questions here before the session's going to be wrapped up. But would I know in my conscious mind what is going on when I'm under hypnosis?
Yes, unless, of course, you don't. Sometimes
Okay,
people...
explain that for me.
So sometimes people, when they come in, they deservedly will pay attention. But because I record it, once they've heard me, then they'll drift away and do a good job later in their own home. Other people, they drift away. They might be a little more trusting, a little more easy. And I never expect a person to trust me. I have to earn that. And I'm in no hurry. I know that they have an ability to do this. It might not happen today or the next day, but eventually it will happen.
Well, if I were hypnotized, would I still have control over myself?
Absolutely. You know, some of the stories, those anecdotal stories that say you can hypnotize somebody and get them to do something that's wrong or harmful, just aren't really true.
So you do this every day. Has it ever failed? Does it work every time?
Well, I'll tell you a story. There was a fellow came to see me, and I'm going to call him Joe. And Joe came to my office, and I looked at him. And I saw the gray. And I said, Joe, how long do you have? He said, maybe 6 weeks. And he handed me an envelope. And his wife said in this letter that I was to psychologize, psychiatrize, theorize, whatever I had to do to get him quit smoking. And I looked at Joe after I'd read the letter, and I said, Joe, do you want to quit smoking? And he said, heck no. And I said, why, Joe? And he said, it helps me put up with her. And so I had to tell him, you're going to have to tell your wife I apologize. I won't be able to do that to help her, to help him. And I beg her forgiveness. And I said, Joe, could I do something more for you then before you leave? Maybe to help you with pain so you don't have to pass on morphine. And he said, I'd love that. And so we did our work.
So you've been doing this for many years now. A couple of quick, tough questions. On average, how many sessions does it take to get results? What does it cost, and is it covered by insurance?
I'd say most people I'd see are 1 to 2 and maybe up to 5. I charge about $120 an hour. Other people charge less, some more.
And does insurance cover this?
Not normally. And it, if a person was a trained psychiatrist or certain psychologists, they may be able to do that. Some social workers.
Well, I'll tell you, I would want to thank you very much for joining us here today, Dr. Hollingsworth. This has been very interesting for me and very enlightening for me, and I'm sure for our audience. So until the next time, this is Bob Neugebauer signing off for Health Conclusions. We hope you will join us again at the same time next Sunday for another hour of informative talk about nutrition, exercise, and alternative medicine options. We are sponsored by AltruaHealthShare.org, and this is 580 KIDO signing off. Till next week.